medullary versus the Weber syndrome. And we are going to look at the first question, that is the clinical features of the lateral medullary syndrome. So in this video, we'll find the answers to this question and we'll learn in detail. So to start off with, we are going to look at the medial medullary syndrome. So the medial medullary syndrome. So this is aka the Dejerine syndrome. So where it is the vessel which is involved? The vessel is the vertebral anterior and the vertebral artery, as well as the anterior spinal artery. So these two arteries are involved. So what about the clinical features? The clinical features is that there is a contralateral loss. This loss of the conscious. Out of the conscious, that is proprioception. And then there is a contralateral. Hemiplegia. Next, there is also ipsilateral. There is ipsilateral tongue. There is tongue paralysis. So just to recap, we learned about the medial medullary syndrome or the Dejerine syndrome. So the vessel involved here is nothing but the vertebral artery as well as the anterior spinal artery. And clinical features, there is a contralateral loss of what? Loss of the conscious proprioception, as well as there is a contralateral hemiplegia, and there is an ipsilateral tongue paralysis. So then we move on to the lateral medullary syndrome. Next we have the lateral medullary syndrome. So what is this lateral medullary syndrome? The lateral medullary syndrome is also known as the Wallenberg. It is also known as the Wallenberg syndrome. So this Wallenberg syndrome, the vessel involved. So what is the vessel which is involved? The vessel which is involved is nothing but there is the vertebral. There is the vertebral artery. So the vertebral artery is greater than the PICA, that is a posterior inferior cerebellar artery. Let me just write it down. The posterior inferior cerebellar, the cerebellar artery. So just to recap, we saw the lateral medullary syndrome, aka the Wallenberg syndrome. The vessel involved is the vertebral artery, which is of higher chance than the PICA, that is a posterior inferior cerebellar artery. Now we'll be looking at the features of this lateral medullary syndrome or the Wallenberg syndrome. So what are the clinical features? The clinical features, it includes it is a contralateral loss. It's contralateral loss of pain. So there's contralateral loss of pain. Then there is also the temperature on the body. So pain on the body. Next, there is a ipsilateral loss. There's ipsilateral loss of pain and temperature. So previously it was on the body. This is ipsilateral on the face. Next, there is the ataxia. There is nystagmus. There is vertigo. On the other hand, there is also the Horner's syndrome, then the dysphagia. There is ipsilateral, this ipsilateral bulbar paralysis, as well as there's loss of gag reflex. There's loss of gag reflex. So just to recap what we saw the clinical features of the lateral medullary syndrome or the Wallenberg syndrome. So in that, the clinical features, it includes the contralateral loss of the pain as well as the temperature on the body, and ipsilateral, there's loss of pain and temperature on the face. Then it also has the ataxia, nystagmus and the vertigo. Then the Horner syndrome, dysphagia. Then there is also the ipsilateral bulbar paralysis, along with a loss in the gag reflex. Next, we'll move on to the Weber syndrome. So what is special about the Weber syndrome? So the Weber syndrome, the lesion, the vessel involved, it is nothing but the posterior. This is a posterior cerebral. This posterior cerebral artery. So this is the vessel which is involved. So what about the clinical features? The clinical features is that there is a ipsilateral oculomotor. This ipsilateral oculomotor nerve palsy. There is ipsilateral oculomotor nerve palsy. And there is also the ptosis. There is ptosis, and this is with a fixed dilated pupil. Ptosis is with a fixed dilated pupil. And this is nothing but it is pointed down. It is pointed down and out and out. Then there is also the contralateral hemiplegia, as well as the contralateral paralysis of the lower face. Paralysis of lower face. Now, just to recap what we saw the Weber syndrome. So Weber syndrome, it was the vessel involved was a posterior cerebellar artery, and we have it here. Now the clinical features, it has the ipsilateral oculomotor nerve palsy. So that is nothing but ptosis, and this is with a fixed dilated pupil. It is pointed down and outward. So down and outward. And then there is a contralateral hemiplegia, and this contralateral paralysis, and this is present in the lower face. So now we'll be looking at the answering our question. So the question we asked was in terms of the lateral medullary syndrome. So this was the question we asked. In terms of the lateral medullary syndrome, this is aka the Wallenberg syndrome. So in this case, what is the clinical features? So the clinical features is that there is a contralateral loss of the pain and temperature. In short, I will be writing as P and T. There is a pain and temperature. This is with the respect to the body. Then there is IL, that is ipsilateral loss, and this is in the again pain and temperature. This is on the face. Next, we have the ataxia. There is ataxia, and there is also nystagmus, and there is vertigo. Then we have the Horner syndrome. Next comes the dysphagia, and we also have the ipsilateral bulbar paralysis. Ipsilateral bulbar paralysis, as well as the loss of the gag reflex. So just to recap, we asked the lateral medullary syndrome's clinical features. So that is aka the Wallenberg syndrome. The clinical features is contralaterally there is a loss in the pain and temperature in the whole body, and ipsilaterally there is also the loss of pain and temperature, but this is associated only with the face. The other features, it includes the ataxia, there is nystagmus, there is also presence of the vertigo, and it also includes the Horner syndrome as well as the dysphagia. There is ipsilateral bulbar paralysis as well as the loss of the gag reflex. So this was about the medullary syndrome. So to grow daily, please do subscribe.